Welcome to the debate. If weight loss is just this simple math equation of calories in and calories out, how do you actually fix a metabolic ledger that is just fundamentally bankrupt?
Right, that's the big question.
Exactly. Today, we're examining a therapeutic landscape where that simple math really seems to break down. We're looking at Ayurvedic treatments for severe morbid obesity.
Yeah, and we're drawing on some pretty fascinating clinical perspectives here. We have an academic review of a therapeutic powder massage called Udvartana and a really detailed case study of a patient who lost 19 kilograms.
And she completely regained her mobility, which is huge.
Right, without any bariatric surgery, just purely through this intervention.
So the core question we're unpacking today is whether this documented success actually stems from unique pharmacological interventions. Treatments that claim to actively detoxify the system and physically liquefy fat. I argue that Ayurveda provides a really distinct structural metabolic reset, treating the root causes of obesity far beyond just, simple calorie counting.
And I contend that these impressive outcomes are fundamentally the result of severe caloric restriction, plus some basic physical therapy, just sort of wrapped in traditional terminology. To me, it's conventional thermodynamics, not this unique fat-melting pharmacology.
Well, we need to look at how Ayurveda actually views obesity first. It's not just a surplus of calories. The source material frames it as a complex disorder where your baseline metabolic fire, the engine that actually burns fuel, is depressed.
Okay.
They call this Datvagni Mandya. And if you look at the patient in the clinical case study, she was 145 kilograms.
Yeah, and she was completely immobile, right? The paper said it required 5 people just to shift her onto a bed.
Exactly. She had severe cervical spondylosis, her blood pressure medications were failing, and she was recommended for bariatric surgery. Western interventions had essentially hit a brick wall here.
Which is a tough spot to be in.
Truly. But Ayurveda succeeded here by attacking the root toxicity and metabolic dysfunction. They used systemic detoxification and deep tissue therapies to force this permanent structural reset. That's what allows for the sustainable weight loss we see in the clinical data.
Look, taking a patient from 145 kilos down to 126 and restoring her ability to walk, that is a monumental clinical achievement. No one is denying that.
Right.
But let's look at the actual inpatient diet prescribed in the study. A single piece of bread for breakfast, a bowl of thin moong dal soup, 1 roti, a little bit of buttermilk.
It was restricted. Yes.
Very restricted. The biological reality driving this success is an aggressively enforced near-starvation caloric deficit.
I know the phrase fat-melting treatments sounds a bit like late-night infomercial magic to a modern ear, but we can't ignore the physical interventions happening alongside that diet, specifically Udvartana, the dry powder massage.
Which is exactly where I get hung up, honestly. Deep pressure massage absolutely improves lymphatic drainage. And sure, friction raises local skin temperature.
Right, so you agree it has a physical effect.
A superficial one, yeah. But jumping from improved circulation to the active liquefaction of subcutaneous fat, that is a massive leap. It's kind of like rubbing a cold stick of butter with sandpaper.
Sandpaper?
Yeah. You're creating friction and heat on the surface, sure, but you are not melting the core of the butter. You're basically just mechanically pushing venous blood and lymphatic fluid toward the heart.
Well, your sandpaper analogy kind of assumes the skin is just this hard, impenetrable shell and the powder is purely abrasive. But we know the skin absorbs.
To a degree, yes.
Right, so think of it more like a transdermal patch delivering active compounds or like a sponge. Ayurveda operates on a principle of opposites. Fat is considered heavy, cold, and sticky, so they attack it with specific herbs like culata that are hot, sharp, and dry.
But how does that actually break down fat cells?
This targeted pharmacology dilates the skin's pores and raises the local temperature. The herbs are absorbed to actively break down and liquefy that subcutaneous fat. It's a process that texts specifically call metabolism.
But look at what kind of weight she was actually losing during this process. Because a peer doctor during the case study presentation raised a really vital critique about this.
The fat-free mass argument?
Exactly. When you put a patient on a crash diet of that severity alongside heavy physical manipulation, Are they losing actual fat tissue, or are they just burning away fat-free mass? Muscle, ligaments, water weight.
But that ignores the clinical improvements.
Let me just finish this thought. The scale goes down, sure, but if the body is starved, it consumes its own lean tissue. So a drop in weight alone doesn't prove her metabolism was miraculously reset. It basically just proves her body was in a severe catabolic state.
Okay, but if this were merely a crash diet destroying her muscle mass, her overall health would have absolutely plummeted. Instead, why did her severe knee pain drop from a 6 out of 10 down to a 2?
Well, carrying less weight.
And why did her total cholesterol drop to 198? Her waist circumference sustainably shrank from 63 inches down to 57 inches over several months. You do not get those specific localized reductions in circumference or marked improvements in lipid profiles just by shedding water and muscle.
Fair point on the lipids, but
Furthermore, she lost 3 kilos in the hospital, but dropped another 11 kilos at home after discharge. That points directly to a sustained metabolic shift, not just some temporary caloric deficit while she was locked in a ward.
look, shedding gross mass of any kind relieves pressure on weight-bearing joints. That explains the knee pain. But we have to look at the diagnostic blind spots openly admitted by the clinicians in the source material.
They were very transparent, yes.
They were. They noted the hospital lacked the tools to actually differentiate between subcutaneous fat and visceral fat. They didn't have calipers or MRI analysis.
Because they were working within a clinical reality. I mean, they didn't have unlimited resources for imaging.
Right, and because of those financial constraints, they also skipped vital endocrinological baseline testing. A peer doctor specifically asked if a serum cortisol test was done to rule out hormonal causes for the obesity.
It wasn't, because of the cost.
Exactly, it wasn't. 1,000 rupee test was deemed too expensive for the patient at the time. Without measuring visceral fat and without a baseline cortisol test to rule out pre-existing hormonal issues, it is just scientifically premature to claim this treatment cured a specific metabolic disorder.
It's true, we don't have the granular allopathic metrics like a cortisol baseline, I'll give you that. But look at the empirical outcome standing right in front of us. Her BMI dropped from 68 to 59.
Which is incredible.
She arrived on a stretcher, unable to even turn over in bed, suffering from severe depression. And she left utilizing a walker. Her state of mind vastly improved. The comprehensive success of this intervention validates the approach. We don't need a 1,000 rupee test to prove that a woman who is entirely immobile is now walking under her own power.
It is absolutely life-changing for her. I completely agree. But attributing that success to an ancient transdermal pharmacology rather than a highly controlled multidisciplinary physical therapy and severe caloric restriction, I think that obscures the actual biological mechanisms at play.
Well, I think the evidence suggests that Ayurveda provides a really profound multidisciplinary intervention treating the root metabolic causes of morbid obesity. Through targeted detoxification and tissue-specific therapies, it achieves a systemic reset that standard Western diets and bariatric surgeries often fail to provide.
And I would summarize by saying that while the clinical care, the inpatient environment, and the psychological support are undeniably effective, the physiological outcomes are basically the results of an incredibly strict caloric deficit and basic physical therapy. It is modern thermodynamics just functioning within a highly supportive traditional framework.
Right, but I think we do converge on a pretty crucial reality here.
Oh, for sure.
For patients who are immobile, who have just been failed by conventional systems and are facing morbid obesity, an intensive, holistic inpatient protocol like this can be truly life-saving.
Absolutely. I mean, regardless of whether the exact mechanism is ancient transdermal pharmacology or basic thermodynamics, the care and the clinical outcome for this patient are just extraordinary.
It really highlights a fascinating tension, between empirical success and modern diagnostic tools. Sometimes a patient's profound recovery outpaces our immediate ability to measure exactly how it happened under a microscope.
That is very true.
We definitely encourage our listeners to explore the source material and examine that tension for themselves.